Okay, so Linda, I think before we go any further, let's put a blanket on you. I don't want you to get cold. And we are going to be doing anti-inflammatory for acute, which does make people cold, because that green fluoride is the ice of the mineral kingdom. So we mustn't forget. And of course, this is the magic blanket that everybody loves.
Yes.
Have you ever felt anything this soft? I know Belinda in Cape Town has an even fancier one. It's got like sheepskin or something on the one side, and this soft here on the other. But this is what we get in the US. This blanket. All right. And we're not complaining. Good. Feel good?
Yes, thank you.
All right. So now what we'll do, we've done that shungite detox, and we've got the cashew and the common opal working away, absorbing the toxins and acting like sponges and doing all their good stuff. And what we're going to do now is actually basic prep and just sweep away some of the toxic matter that we have moved into the energy field. So we'll just do our fanning. Side. And of course, we won't forget the soles of the feet, because we even found cording there. That's it. Just check. No, there's nothing over your knee. So that part's good. All right. Then I can choose which of my sweeping instruments I'm going to sweep with. So this is my quartz with fuchsite or fuchsite in it. That's what that green material is, which is a mica. Fuchsite is a mica, and it moves stagnant energy. So that's pretty good clearing tool. But because Linda's feeling a bit stressed and her system needs calming, I'm going to rather use this one. And this one is amethyst. I'll turn it over there, you can see the amethyst. And then this is calcite, and it's the calcite structure. These are very flattened tops, and it is very soothing material when I sweep with this. It's very settling and reassuring and calming. It's just a lovely soft feeling, and because Linda was feeling a little stressed and uncomfortable, I want to use this one rather. But I do need to clear it in the bowl. Let's get that. Feel it getting heavier. When I feel the stone getting heavier, then I know that it's collecting debris. That's it. It's soothing, isn't it?
Mm-hmm.
Yeah.
I might fall asleep.
Exactly. I felt you zoning out on us there. Don't be fooled. You're not relaxing. You're working. You're being a model. And there's the smile again, you see. So that's always nice to see. Let me go down the midline. Nice. One more time. Right. So then, next step, let's open the chakras. And actually, I think what I want to do is I want to use this end. So this is a chevron amethyst. Here, that's the handle of my wand. And I want to actually use this for adjusting the chakras. Strong, huh?
Mm-hmm.
I've got an experience feeling how the wing and the feathers draw the energy up and out like a fountain. It's actually pretty cool. Pretty cool experience, that. Wow. All right. So, let's move on to hydrating with moonstone, because there was lots of aches and pains and stuff to do with the fascia being a little bit overcontracted, and in order to work with that, we must hydrate. Hydration is the key for fascia, for muscle tissue, for metabolic health. We must hydrate, hydrate, hydrate. And our magic ingredient for hydration is moonstone.
So soothing.
Nothing like it. And moonstone, do you know what it actually is? Because obviously moonstone's not its real name. It's Adularia. Adularia.
Oh.
And it has that blue shine. That blue shine that moonstone has, that's adularescence. Because only Adularia has it, so they call it adularescence. Tongue twister. I think your knee's better already.
It is.
I can't feel anything there, any stress there anymore. That's all right. We're still going to go forward.
A little bit left in my calves.
Yeah, it's not in your knee. Yeah, I get it. But we are undeterred. We're not going to let anything trick us. So we've done a moonstone infusion. Lovely. All right. And now let me use the fardens and my garnets to draw stress off the system, because we talked about stress, so let's do that. I'll just use the fardens here on the big toes. Lovely. Now there's that flow, sort of feeling of everything emptying out, all the stress just draining off the system. Fabulous. Really, really good. Oh, lovely. And quick. I think that the sardonyx really prepped you well. That's it. That's right. And then to open up the channels between the chakras for an even better flow, we're going to put the garnet. I'll put them on top actually so everyone can see. Put them over there on the arch of the foot. That's right. Right, so what I'm going to do is I'm going to do anti-inflammatory for acute from the knee to the foot here, because it's actually all of this lower leg that's kind of tight and affected. Good. Nice. So let's get our green fluoride there. energy field infusion. There, that's hitting the spot. There's this big elliptical motion. That's it. There it goes into the tissue. I just suddenly felt it penetrating. Very good. And actually that insight about the soles of the feet, let me just, yeah. Right, that's done. Now we can use this one. And I say this green shows up well on this color here. That's good too. Good to know. I'm just checking the texture and the quality as this goes into the energy field. Texture and quality of the etheric tissue, and it's pretty good. The thing with checking the quality of the etheric tissue, you have to become familiar with it. It's not something I can explain. It's something that's comparative from client to client. And from the same person to that same person a week later to a week after that. These are comparative assessments. So you have to have a bit of experience to be able to do that. And now I'm just pouring the green light from the fluorite obelisk into the knee. And there it goes. I'm actually going to lift that away and just get it into the knee joint. That whole capsule can do with a little extra anti-inflammatory work there. That's it. Good. There we go. And it's quite interesting because what appeared on my mind screen was rivulets of inflammation running down through this tissue here. It's like little rivers of inflammation. Not intense, but there. Distinctive. So I need to just pour the green fluorite into the rivulets to antidote them. And here, as I'm doing this, I'm visualizing the cells of the energy field and that I'm pouring the green into the cells of the energy field. So up here, I was actually visualizing the knee itself. Over here, I'm visualizing the cells of the energy field. Because I need to get a wraparound effect, I'm working on the back of the calf muscle at the same time. So I'm pouring it into this tissue here, and from there it's going to transfer into the physical. Right, now the green apophyllite moves, so this now is treating. Now the spirit guides are reminding me that I didn't do the steps for irritable fascia, which are obviously necessary. And so I must do those next. And I'm asking the guides, what should I do? Should I stop what I'm doing and then do that? Or should I finish this? And they're saying, finish this step and the zincite step, then do the irritable fascia step, and then later complete with the green wand. So there, I've done that and that. So that's good. And now I must do the zincite step, the guide said. I'll use my zincite needle. I'm going to need this. And I'm going to do this whole strip. I'm going to come like so. This is 3D gridding. Right. Right. Good. Side. And then I have to go east-west. Right, and then I have to go in the third dimension. Oh, there, that's the layer. Now that one I can feel really hitting the spot. Nice. Brilliant. And this is a crystal surgery, and so that's why Linda has fallen asleep. Despite being in front of the camera and all the talking. Right, so next I'm going to work on the irritable fascia. So actually I need this here. And for this I use my Thunderbear Amethyst, and I've got a nice red cap with a very nice little red head there, and my diopside. It is very helpful to do the moonstone technique before doing this irritable fascia step. And of course we did do it. That's it. Now, I must pay special attention to her arms, so let's go up there. This side. Right. Very nice. And let us just use the green wand to finish off here now. Let's start with the fluorite end. You can see this is a somewhat different movement when using the green wand from when I was using the zincite wand. It's a different action. Never skip any steps when doing anti-inflammatory for acute. Every step is important. Wow, that's great. And there we are. That's anti-inflammatory for acute. Next, we're going to work on the hands. Okay, so now what we're going to do is put some rose quartz stones. We're going to move into the next piece of the session. And I'm going to put my rose quartz stones on because we are still going to do the anti-depression procedure. And this is how we're going to get that moving along. We've done sardonyx, we've done shungite. We're going to do more, but let's get the rose quartz chakra stones on, and then let's go work on the hands while those rose quartz stones are doing their magic. I'll work over here. Let's pull that back. And let's take a look at this tissue. No sign of stress in your fascia right this second. There, more. Yeah. So it's important to note that the fingers work from way up here at the elbow, and so for massage therapists, all this tissue can get very overcontracted, and quite a few massage therapists have had to get help from me to do with their fascia here. And we want to get that to open and release. It's very responsive. I think everything we've done so far has been super, super helpful. And I'll just look for a few more hints of stress. There's one. Sorry about that, Linda. It does hurt. That's it. That's it. See, there's your hand lengthening out now. That's good. Oh, yeah. How's it feeling in here right at this moment?
It feels good with your healing hands.
Yeah, it says that my hands are comforting.
Yes,
yeah,
very comforting.
Okay, good. Yeah, that's a little bubbly, isn't it?
Mm-hmm. Is that a tendon or?
Well, those are all the tendons coming down here, but it's a bubbliness in the fascia and in the muscles.
Mm-hmm.
You don't want that. That's it. That's it. So what I'm doing is I'm taking hold of that. I'm squeezing it and seeing whether that will release the tissue down here with what's in my other hand, and it is working. See how your hand lengthens out when I do that. So this is an Alexander technique move. We call it hands on the back of the chair. We get the thumb to oppose the fingers, and if I pick it up like that, that's Alexander technique. So it's like that, but otherwise what will also help is trigger point therapy, you see. And then the other thing that helps is aromatherapy oils. So lavender is very good. This is deep healer potion. That's a mixture of aromatherapy oils. And I'll just put this on. So we make this ourselves, the deep healer potion. And it's got a lot of aromatherapy oils in it and some other ingredients. Crystal elixir. There's crystal elixir in it. Now we can make a crystal elixir with the Thunder Bay amethyst and diopside for the irritable fascia. It would probably work very well. So again, remember, I am not a massage therapist. I am just putting this deep healer potion in, and then I'm using my Alexander and healing hands for the hands-on contact and doing laying on of hands. So Don't go beyond your qualifications. Don't go beyond what you're allowed to do by law. Don't go beyond what you know how to do. Oh, that's nice, isn't it? So I just want to be with this tissue. There we go. The less I do, the more she can respond. So allowing of flow. That's delicious, isn't it? Right. Very nice. And of course, people with arthritis really appreciate when you work with their hands in this way. Very nice. How's that feel?
Really good.
You are getting spoiled today.
I am.
Let's take a quick squiz on this side. Just sounds a little tighter than the other because it's your right side, it's your dominant hand. That's
A little more into my elbow on that side.
yeah, that's why I pick up this tissue here with my hands on the back of the chair. And Alexander hands and just get that. Wow, that's meaningful, isn't it? Woohoo, lovely. Alexander technique to the rescue. Oh, wow, there's the bone. Oh, there's what we want. Phew. Lovely. Very good. That's it. That's it. We were watching a baking show and we saw the one guy's hands spasm up from kneading the dough for such a long time. Actually, I don't think it was dough, I think it was fondant. There we go. You see now the upper arm is releasing the lower arm. It was hooked together too harshly. There we go. Oh, good. Nice. All right. Just to be quiet with it is really important. So I just get as much of my hand on as close to the bones as possible. I've got the radius and the ulna in here. Just get to the bones. That's it. And then the tissue releases off the bone, and that's what we want. There's the hand. Relaxed now, fully relaxed. It's lovely. All right, so then we can put on some of our deep healer. Lovely, lovely. This is all. What you want is getting everything going in the right direction, and then, the body knows how to heal itself. It just needs a little boost every now and then, and so that it can do what it knows to do. Nice. Lovely. 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 Delicious. Very good. Alright, so that will get rid of some things that lead to irritability.